Hello, everyone. My name is Lindsay Porter,
And I'm Jackson Hall.
and we are both students at the University of Kentucky College of Pharmacy. We are part of the Service Learning Project for the youth, and we are just here today to talk to you guys a little bit about immunizations and why they are so important to keep you and your families safe. So, starting us off, we all know COVID-19 this year has changed everything about our world, from the way we shop, socialize, and even moving your schoolwork and classes online. Now more than ever, we really want you all and your families to be safe. So we wanted to talk to you guys a little bit about how important it is to do what you can to stay healthy in this scary time.
And even though we don't have a COVID-19 vaccine yet, we want to educate you all just on kind of what it might look like once we do get that vaccine sometime, hopefully in 2021. So if you want to look at this little graphic that we included on the right here, this is basically telling us about all the manufacturers and companies that are working right now to create a vaccine. So there's a bunch, and if you look at the tallest column on the left there, we see that 142 companies have a vaccine that's in preclinical testing. And that basically means they're just getting started, so they still have a ways to go. But then if we look over to the right, it says phase 3, and we see that there are 9 manufacturers that are in the last phase of basically creating a vaccine. And even though this may still take well into 2021, it's definitely still promising, knowing that we have basically 9 manufacturers that are getting really, really close to having a vaccine. So that just kind of gives you a better picture about where we are with that vaccine.
Yes. And as we go through this presentation, just be on the lookout for the yellow stars in the top left corner of some of these slides. These are our most common cues or common questions that we think are most important for you guys to take home today and share with your families. So our very first common cue is, how do vaccines work? So to start off, vaccines take advantage of your body's natural defense system, your immune system. And the immune system is what protects you from harmful germs in the environment and allows you to fight them off. So what's so cool about them, or about your immune system, is that it's smart. So it's able to remember germs like bacteria and viruses and get better at fighting them off over time. So if you look at this little graphic we have on the left, starting off, we introduce your body to a weakened or killed form of the virus or the bacteria, like these guys here in gray. So they won't be able to hurt you when they're inside your body. Then your body actually creates antibodies to fight the germs. So that's these little kind of Y-shaped guys here in the middle. And then if the actual disease ever comes into contact with your body, so the red here, your body will recognize it and be better able to fight it off. It's like giving your body a head start on the disease.
Yeah, and so what Lindsay just said matches up really well with also this graphic on the right here. And this shows your initial exposure, which, if you can see on the bottom, is your vaccination. So that's your initial exposure. And you can see how it's causing a primary immune response. And this is basically just waking your immune system up to the virus or to the germ. And this allows your body to make memory cells, which can recognize it again. And then when you get exposed to this virus or germ again, your body is able to have a better and faster response than it did before. And so now we will talk about kind of what makes up a vaccine. So there are 4 main types of vaccines. The first one is called a live attenuated vaccine. And this essentially takes a weakened form of the germ and introduces it to your body to mount an immune response. And these are pretty similar to natural infections in the sense that you're going to have a strong and long-lasting immune response with these. Next, we have inactivated vaccines. And so this is just what it sounds like. It's an inactivated or killed version of the germ that we introduce to your body. And with this, you're going to have a a slightly lower immune response than a live vaccine. And it may require boosters, which I will get into in the next slide. The next one we have is called a subunit vaccine. And so if you think of a like a germ or a virus, there's many different parts. And so these use a specific part that your body can recognize and use that. And like I said before, with the inactivated ones, these may also require booster doses. The last main type that we have is called a toxoid vaccine. And so these use a toxin or some kind of harmful product that is made by the germ that causes disease and creates immunity to the disease causing parts. And just like the previous two, you may also need booster doses with this one as well.
And then on the right, we have what we call our supporting cast. So things that are added to the vaccine to make them work better or last longer than they would just with that germ or virus inside that you're actually having the immune response to. So these include things like preservatives to help prevent contamination, adjuvants like aluminum salts that help boost the body's response to the vaccine, stabilizers to help keep it effective after it's manufactured and while it's being stored, residual cell culture materials like egg protein, which helps us, grow enough of the virus to make the vaccine. Residual inactivating ingredients like formaldehyde to just kill that virus and make sure that it's safe to inject into your body. And then residual antibiotics like neomycin to prevent contamination by bacteria as that vaccine is being manufactured. It's important to note that while some of these things, like formaldehyde, aren't good for you in large doses, the amount that's used in vaccines isn't any more than you come into contact with through your food or water sources or that already exist naturally in your body. So they're safe to have in a vaccine, especially since they make them so much more effective.
And now I'll go back to what I was kind of touching on in the previous slide, booster doses. So for all vaccines except the live attenuated, these are slightly less effective because they aren't causing your body to have as drastic of an immune response as the live vaccine. So these may need second or even third doses to boost your reaction, kind of like it shows in this graph. So the initial vaccination, you develop some sort of immune response, but it's not as good as we want it. And so after this booster vaccination, you get an even greater and faster immune response, and that's just better for your overall immunity.
So then another common cue, I've gotten the flu vaccine before and I've still gotten the flu. Why should I keep getting it? And this is one that we hear all the time out in the community. So why might your vaccine, quote unquote, not work? So there's two really important things to note here. Number one is as soon as you get a vaccine, you're not automatically immune to whatever you just got vaccinated against. So it takes a minimum of 7 to 10 days after you receive a vaccine to have built up enough antibodies to be protected from that virus if you come into contact with it. So let's say, for example, you got your flu shot on Monday and then you were exposed to someone who has the flu on Tuesday. That's really terrible luck, but it's likely that you would begin showing flu symptoms and feel sick because your body hasn't had time to learn the flu virus from your vaccine and build up enough antibodies to protect you. Another really important thing is about viral strains. So over time, viruses and bacteria have gotten pretty smart, and they've evolved and mutated into different strains to maximize their infectiveness. So our vaccines cover the most likely strains that'll be in the community every year. So the flu shot either covers 3 or 4 strains, depending on which vaccine you get. And there's lots of really awesome public health officials that work every single year to make sure that we're covering the strains that are most likely to be out in the community, but we don't always get it perfectly right. So there is a chance that you get vaccinated against those 3 or 4 strains, but then get exposed to a different strain that causes you to have the flu.
So the next question we see a lot is, I've had the flu before and it wasn't that big of a deal. Why do I even need to get vaccinated? And this has to do with a thing called herd immunity, basically protecting those who can't protect themselves. So you may have gotten the flu before and felt sick for a week or so and then recovered. And for a young, healthy person like yourselves, it's not likely that you'll have many long-term consequences from something like the flu. However, if you were around people who are high risk, such as elderly or people without strong immune systems, there's a much higher chance of you passing it on along to them and really risking their health if you don't get vaccinated. So if you want to look at this picture on the right here, we have a few different scenarios where in the first one, we have if no one in the population is immunized, sorry. And so even if two people get infected, there is a huge effect on how many people will eventually get sick. And in the next scenario, one line down, we have when some people are immunized and this disease still spreads through the population, but much fewer people get sick in this case. And in the third case, we have where most of the people in the population are immunized, and the disease spread is ultimately constrained, and overall public health is at its best. And so this is especially important when we talk about things like COVID-19, because we don't know about the long-term consequences, even to young people like yourself. So if you're able to get vaccinated and can avoid infection, you're saving yourself from those potential consequences.
So the next common question that we often get is, how do you know exactly what vaccines that you need? So we really want this slide to be kind of your roadmap so you know exactly what vaccines you need to be safe. So starting off, we have the influenza or the flu vaccine. The flu is spread through respiratory droplets, so like coughing, sneezing, or talking to someone who's infected, as well as surfaces. So it's really important that you wash your hands and try to keep your surfaces clean, especially common surfaces, as much as possible during flu season. The virus causes respiratory disease, so cough, runny nose, sore throat, fever, and it can develop into a more serious lung infection called pneumonia if the disease is allowed to progress. It's recommended that everyone ages 6 months and older get a flu vaccine each year, and there's technically no booster because you are getting that vaccine every year. So also to prevent getting sick, make sure you're using good hand hygiene, avoid sick contacts, and stay home if you are sick to avoid exposing others. Next, we have Tdap or TD, which is our tetanus, diphtheria, and pertussis vaccine, or just for tetanus and diphtheria. That disease is spread through exposure through cuts on the skin. So if you step on a rusty nail, you're bitten by a dog or something like that. It can cause stiffness in the neck, difficulty swallowing, and muscle spasms if you're not vaccinated against the disease. So it's really important that you get that vaccine. It's recommended you get one dose at ages 11 or 12, and then a booster dose every 10 years. So it's really important that you stay up to date on that as much as possible and be sure you know, just in case if you ever were to, step on a rusty nail or get bitten by a dog or anything like that, and needed to go seek emergency treatment, they would probably want to know when you got your last tetanus vaccine, so they know if you need one while you're in the hospital or at the doctor's office. And then to prevent getting sick, just use caution to prevent cuts, especially if you're working around metals, walking around barefoot, things like that. Next, we have HPV or human papillomavirus, which is spread through direct physical contact with another person. It can cause cancer, so it's an extremely serious virus, primarily cervical cancer in women, but it can also lead to other cancers. It's recommended that if you get your vaccine before you turn 15, you're going to get one dose at 11 or 12, and then a booster dose 6 to 12 months later. If you get the vaccine after you turn 15, you'll get one dose, a second dose 1 or 2 months later, and then a third dose 6 months after you got your first dose. So basically, if you get it before you turn 15, it's a 2-dose series. If you get it after you turn 15, it's a 3-dose series. Next, we have meningitis, which is spread through direct skin contact, water droplets. This is commonly spread. We hear about it through sharing drinks after other people. It can cause, the disease can cause fever, headache, stiff neck, or a long-term brain infection, which can lead to really serious consequences like deafness, stroke, or even death. It's recommended you get one dose when you turn 11 or 12, and then a booster dose whenever you turn around 16. To prevent getting sick, you can just practice good hand washing, avoid sharing cups or drinking after others, and then use extra caution. You guys are, as you move through high school and graduate and move to a dorm or maybe live in another type community setting like an apartment, just use extra caution that you're not or that you're washing your hands and avoiding the germs of others as much as possible. And then last, we have our hepatitis A vaccine. That's spread through the fecal oral route, so exposure to food after someone didn't wash their hands properly. That's why in the news you've probably heard a lot about people being exposed after they ate at a restaurant or something like that. It can cause GI symptoms, so GI virus like nausea, vomiting, diarrhea, which is definitely no fun, but then more serious consequences are liver dysfunction later on down the road. So definitely want to avoid this by getting vaccinated. Recommended ages are 1 dose as early as age 7 or 8, and then a booster dose 6 to 12 months after you get that first dose. And then just to prevent getting sick, a really important strategy is to practice good hand washing, especially if you work in a restaurant or in the food service industry. And then vaccine schedules. So the Center for Disease Control provides immunization schedules for every age group. So show that to your family members or whoever lives in your household and just ask them, are we all up to date on these vaccines? The link is there. And then if you aren't 100% sure, you can always ask your school nurse or your doctor if you're up to date the next time you see them.
All right, so now we're going to review some common misconceptions of vaccines. And so number one misconception that we see is vaccines contain dangerous chemicals. So in the past, vaccines did contain components to preserve them that were more dangerous than today, but these have been removed to all but trace amounts. And so I know we talked about this earlier, but people are going to ask you a lot of questions when talking about vaccines. So it's important to know your stuff. And there are additional components in vaccines to make them longer lasting and more effective, but these are not in any way harmful or dangerous to people. The second one that we see is that you can get diseases from vaccines. This is false, and the only way that you can get a disease from a vaccine is if you're immunocompromised and you receive a live vaccine. And so immunocompromised basically means your immune system does not work like it should. And this can be caused by a number of things, such as being very old or very young, having a disease like HIV, having an organ transplant, or receiving chemotherapy to treat cancer. And it's important to know that you will likely know if you're immunocompromised, so you don't really need to worry or wonder, am I immunocompromised? And if you do need a vaccine, your healthcare provider will know that you're immunocompromised, and we could make sure that you do not get a live vaccine. The next misconception we see is that vaccines can cause autism. This was basically published in an old medical study that was later proven to have a lot of flaws in their study design and very skewed results. So this was ultimately determined to be false. Next, getting a disease naturally can cause a better response and provide better immunity. So this is true, kind of. So if you do get the disease naturally, it will spark a stronger immune response. But at the same time, you're at risk of all the potential complications that come with whatever disease you may get. And so the costs really outweigh the benefits of the increased immunity. And it's also important to note that you could pass this on to someone else. And so that's obviously something we want to prevent. So it's still best to get your vaccines.
Okay, and then our last common question is, where can you get vaccinated? Your local community pharmacy. So your community pharmacist is able to immunize people as young as 9 years old in the state of Kentucky. And these are just some examples of pharmacies around Lexington that you may or may not be familiar with. So places like Walgreens, CVS, community pharmacies, or independent pharmacies like Wheeler, or Grassroots, and then even some pharmacies at UK Healthcare are community or retail pharmacies. So work with your parent or guardian to find the pharmacy that you normally fill your prescriptions at, and then call ahead to see if an appointment is needed for you to get a vaccine. Your prescription insurance will cover most vaccines, but it's really important to check with the pharmacy to be sure so that you don't have any unexpected costs. When the COVID-19 vaccine is available, it is expected, however, that it will be covered by the government, so totally free to you, which is really exciting. So, in conclusion, in our new COVID-19 normal, there's a ton of things that we can't control, but you can control getting your vaccines to keep yourself as safe as possible using your body's natural defense system, which is your immune system.
And your community pharmacist can help you to make good decisions about the vaccines. So you, make good decisions about the vaccines you need based on your specific needs or risk factors. And we would always love to talk to you.
Absolutely. And we really want to emphasize if you have any additional questions about pharmacy, about vaccines, or really anything else, we definitely are here to answer those. We're sorry that we weren't able to connect with you all more over the course of this past year, but COVID-19 has made that pretty difficult, and we want to keep you guys as safe as possible. So we're kind of trying to find ways to do this remotely, but definitely reach out to us if you have any other questions, or if we can support you in any other way. Okay, thank you all so much.